Hello everybody, I am Dr. Senthil Kamalasekaran, Senior Consultant at Chennai Ortho Clinic, and today I'm going to talk about back pain in pregnancy. During pregnancy, women undergo a lot of changes. They have many problems. Some suffer from indigestion, some suffer from constipation, some have urinary problems, but one of the most disabling problems is back pain. I will talk about why you get it and what are the means by which you can prevent it. The most common reason why you get back pain is it's a very natural thing. During pregnancy, you eat well, you put on weight. When you put on weight, you put extra stress on your muscles and ligaments in the back. The other thing is your baby is developing inside your tummy when you eat, and this causes an expansion of your belly and also puts enormous stress in the muscles, bones and ligaments in the back. To accommodate this baby in your tummy, what happens is your body releases hormones called relaxin, and this relaxes all the ligaments and tendons so that your pelvis and your tummy and everything gets more accommodative to the growing baby. Once this happens, your joints get a little bit more mobile, and because of that, they can cause some inflammation in the joints, which can cause pain. Pregnancy also affects your posture because when you have to sit down or you have to get up, you might have to shift your weight to accommodate for the baby size. So that can also put some stress on the back. So your posture is also one of the reasons. So all these are the causes which can cause you to have back pain. But now how do you prevent it? So once your muscles and ligaments get relaxed and get loosened up, you have to always make sure that you tighten it. So always when you sit down, you make sure that you sit down firmly and with a straight back, and also have a support like a lumbar support. So when you're getting up, you make sure that you have adequate support when you get up. Tighten your muscles in your pelvis and your lower abdomen so that you can have a little bit more firm posture. When you're lying, lie down on a firm mattress, not on a mattress which is sinking. If you feel comfortable in lying in a one-side posture, please feel free to do that. So when you're getting up and you're walking, try to walk with a balance. So walk with flat shoes. Try not to have too high heels because that can also offload your posture. Make sure that you're eating well, drinking enough water to stay healthy, and also make sure that you are doing some exercises to keep your back strong. What exercises will help you? You can ask your therapist, you can also ask your doctor, and they will be able to guide you on what exercises in pregnancy which will help your back pain. So eat a diet rich in calcium and make sure that you have a source of vitamin D in your diet to make sure that you are keeping your bones healthy. By doing all this, you can keep your back strong during your pregnancy period and avoid having any back pains. Hot water massage or even a small kind of a liniment or a gel which you can rub down on your back can also take away the pain in your back. You can also take medications like paracetamol, which is very safe. Anything else, you need to consult your doctor. I hope this short video was able to give you some kind of insight into how to prevent your back pain. If you like it, please do like, share and subscribe. Thank you.